Hello, I hope you're still safe from conjunctivitis, the red eye disease. And those who have it, this video is for you as well. Maybe you can, do something to prevent its spread from one person to another. So, viral or bacterial conjunctivitis is very, very contagious. That means it can easily be spread from one person to another, especially through direct spread and sharing of personal items like pillowcases, towels, glasses, and some of the materials that we use for makeup. So, some people can actually have allergic conjunctivitis. Basically, those people who have allergies, sometimes they also get those red eyes. However, for them it's not contagious, and also we can all do something to reduce the spread and also prevent the risk or reduce the risk of getting it by doing the following things. One, we have to wash our hands, we avoid direct contact with infected people, avoid touching or rubbing our eyes, and report any cases that come up in our community. So what is conjunctivitis? Basically, it's the red eye disease, and it affects that whitish part in the and also inside the eye. It's usually caused by viruses, much as even bacteria can cause it, and some allergens. Some of the symptoms that come with this condition include the following. One, the white part, that whitish part of the eye can become red or pinkish, and also the eye can be teary. It can produce a lot of tears. There can be grain or scratchy sensation in the eyes. There can be itchiness, that is a feeling of itching or irritation in the eye, and sometimes they can be pus discharge. Okay, you can really see pus in the eye, and basically there can also be that sticky pus, especially during sleep. That pus usually collects around the cornea. So those are some of the symptoms that this disease usually presents with, and if we see any of these symptoms, we have to make sure that we report to the nearby authorities and also be seen by doctors. So how does this disease spread? One, spreads from one infected person to another, especially through close personal contact. It can also spread through air and sneezing. Also direct contact, when a person with conjunctivitis touches the discharges from the eye. It can also be indirect. For instance, the germs can get or land to a surface that another person who doesn't have the disease can pick it. Also, it can be through droplets. For instance, these droplets which someone can sneeze in the air and someone gets it. So how do we protect ourselves from getting conjunctivitis and also protecting others? One, we have to wash our hands with soap or alcohol-based sanitizer. We also have to ensure that we avoid touching or rubbing our eyes, because that way we can easily prevent spreading of the virus to our eyes. We also have to avoid sharing personal items like makeup and glasses. So for high volume congregation places, these are the schools and institutions, or like markets, we need to screen, especially the children. The children, they may not be able to observe the hand hygiene very well, so we need to always screen them and identify those who seem to be having the diseases and ensure that they are treated. For people who are in the prisons, ensure that the inmates are well taken care of. In the morning parades, you should always check and see if any of them has red eye disease, so that maybe they can be started on treatment. Also, the hand washing facilities that like we had in COVID should be installed again at the entrances of main institutions, so that people can always wash their hands before they enter these facilities. So how do we care for the eyes when we have conjunctivitis? One, so if you have conjunctivitis, you have to limit the spread to other people by doing the following. One, you have to be responsible enough to wash your hands with soap or using an alcohol-based sanitizer for at least 20 seconds, especially if you've been cleaning the eye or you've applied an eye drop. Make sure you wash your hands so that you remove off the germs. Two, with clean hands, wash any discharges that may be on the eye, so that you remove the discharges using a wet clean cloth or fresh cotton ball, and you have to throw this away so that some other person doesn't get into touch with it. And then you do not use the same eye drops with the same person who is infected. And also, we need to always wash our belongings, the pillowcases. We should avoid sharing makeup. Okay, do not share personal items like pillows, wash clothes, towels, and eye drops. Make sure you don't share them, because that way you can easily get the virus. That's somebody who has conjunctivitis hard, and they can easily spread it to you indirectly. So if you're using contact lenses, it's advisable that you stop until a doctor tells you that maybe now it's safe to reuse the contact lenses again. So always clean, store and replace your contact lenses, and also ensure proper hand hygiene. So when you have it, you should be seen by a doctor. Okay, so when you have the red eye, make sure a doctor sees you. A doctor might prescribe for you an antibiotic. These are medicines that you'll have to take, and also eye drops. Okay, so they usually prescribe antibiotic eye drops or ointments, and depending on the type of conjunctivitis. So there are quite a number of different types, but doctors can be able to assess and find out the best one for you. So the take-home message is that this disease is very contagious. It's spread by bacteria and viruses, and you can avoid it by practicing good hand hygiene.